Hello, everyone, and welcome to this audio podcast. This audio podcast was part of the Pathogenesis edition. This audio podcast is part of the Torpedo Storm, as part of a Storm Richter. This is an audio podcast as part of a Storm Logistics production. This audio podcast will look into or delve into the sort of around the service evaluation around chronic kidney disease or young people, pediatrics and young people, pediatrics and young people suffering with C with chronic kidney disease or CKD. Uh, in around pediatric nephrology and young people services, services, there has been a fragmentation of services between areas of clinical practices across different 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 regions, and while one pediatric nephrology site may provide most young people services in around CKD or chronic kidney disease. Another may only offer limited healthcare services, and the delivery of services can also depend somewhat on where a young person lives, which is reflected by the investment and priorities of that area, making it a challenge for young people to receive sort of to, making it a challenge for pediatrics and young people to receive the best care. And there's works published by the Royal College of Pediatrics and Child Health, and there is works published by the British Association of Pediatric Nephrology as well. Acute kidney injury, or AKI, for example, has affected more than 1 in 5 emergency hospitals admissions. AKI survival rates have improved in young people over the years, from 9 out of every 100 in 1999 to 2003 to 18 out of to 18 out of every 100 in 2009 to 2013. So early service evaluation could help up to 105 young adults and young people or pediatric lives per year globally. Some patients with a pediatric renal disease, some some patients with pediatric renal diseases or young renal or diseases specific to diagnoses in around pediatrics or young people reported high incidences um, of um, of uh, uh, renal dysplasia or reflux uh, around renal dysplasia, reflux, obstructive uropathy, and glomerular disease, and these were the most common listed renal diseases for pediatrics and young recipients aged 16 years old with CKD, and accounted for just under 63% of all patients recipients for whom a primary diagnosis had been reported. There are significantly lower rates of preemptive transplantation in girls or females and ethnic minorities, and further investigations or further studies, um, uh, further studies, investigating investigating this sort of prospectively by researchers and investigators would be would be of pertinence and and generally and generally and generally pivotal. Fewer young people than adults have CKD, or chronic kidney disease, but inevitably the care pathway also involves also involves hemodialysis, peritoneal dialysis, or transplant. In addition to CKD, 1 in 3 young people have other diseases, thus making health a health a healthcare healthcare more complex. Out of 100 young people, 75 will have at least one risk factor for a primary or a primary comorbidity, whilst 10 out of 100 will have 3 or more risk factors. That draws this audio podcast, which sort of provides a basis in around the basis and premise in around service evaluation in context of chronic kidney disease and CKD, and sort of pediatric nephrology and young people's services. This audio podcast was part of the Pathogenesis edition as part of the Storm Richter and part of a Torpedo storm. This is an audio podcast as part of a Storm and a Bostics production. Thank you.